Are you simply tired, or are you experiencing more serious symptoms? And did you know that someone in the United States suffers a heart attack every 40 seconds as a result of a lack of awareness regarding the early signs of heart problems? Let's examine the early warning indicators of a heart attack in more detail and why they should never be disregarded. Now let's get started right now. 1. Paleness and cold sweats. Abrupt and inexplicable sweating, especially in the case of cold sweats, may indicate an impending heart attack. Sweating may be more obvious than usual and might happen with or without chest pain. The tension and discomfort that accompany a heart attack can cause the body's autonomic nervous system to go into overdrive. The sympathetic nervous system, which regulates the body's fight or flight reaction, may become active as a result. Cold sweats can come from the body trying to cool itself by producing excessive sweat. Paleness can also be caused by the sympathetic nervous system constricting blood vessels, which lowers blood flow to the skin. Similar to this, the tension and pain of a heart attack can cause the body to release specific hormones, like adrenaline. These hormones can affect the body in a number of ways, such as speeding up heart rate, narrowing blood vessels, and causing perspiration. It is possible for symptoms like paleness and chilly sweats to result from the combination of these hormonal changes. Paleness and chilly sweats after a heart attack can sometimes be signs of shock, a potentially fatal illness caused by insufficient oxygen and nutrition reaching the body's organs and tissues. When the heart cannot pump enough blood to meet the body's demands, poor circulation and a drop in blood pressure can result in shock. Paleness and cold sweats are common signs of shock that need to be treated urgently, since they could point to a serious and possibly fatal condition. Potential heart problems might be identified by keeping an eye out for changes in perspiration patterns. 2. Weary or dismayed feeling. Even after getting enough sleep, feeling extremely exhausted can indicate a heart attack is about to happen. If you're feeling very exhausted, it's important to pay attention to your body and take some time to rest, as this may indicate that your heart is having trouble beating. Exhaustion or dyspnea may also be brought on by the stress and anxiety that come with having a heart attack. The body's natural reaction to stress can worsen symptoms like exhaustion or shortness of breath by raising the heart rate, causing fast breathing, and tensing muscles. Furthermore, having a heart attack can have a physically draining emotional toll that leaves one feeling weak or exhausted. Pulmonary edema is a condition in which there is an accumulation of fluid in the lungs following a heart attack. This happens when there is a problem with the heart's pumping action, which leads to fluid leaking out of blood vessels and blood backing up into the lungs. Breathing difficulties, coughing, and shortness of breath are some of the symptoms of pulmonary edema that might get worse when you move or lie flat. Feelings of weakness or exhaustion may result from the heart's decreased ability to pump oxygen-rich blood to the tissues after a heart attack. 3. Jaw ache. It's true that jaw pain can be an unexpected sign of a heart attack, but you shouldn't dismiss it. The nerves that transmit pain signals from the jaw to the heart can occasionally overlap or cross paths. These shared nerves can cause confusion when the heart is under stress, as it does during a heart attack, and the brain interprets pain signals from the heart as coming from the jaw. We call this phenomena referred pain. A heart attack can cause discomfort that radiates not only to other areas of the upper body, such as the jaw, but also to other places. This happens because pain impulses can flow from the heart to the jaw due to comparable neural connections between the two organs. Even though chest discomfort is the most typical sign of a heart attack, not everyone gets it, particularly women and people with diabetes. Alternatively, they might exhibit unusual symptoms including neck or arm pain, back pain, or jaw pain. Jaw pain can therefore be a potential warning sign of a heart attack, especially if it coexists with other symptoms like nausea, shortness of breath, or chest discomfort. 4. Discomfort in the digestive system. During a heart attack, some patients may feel gastrointestinal symptoms as nausea, indigestion, heartburn, or stomach discomfort. These symptoms may manifest singly or in conjunction with discomfort in the chest. The heart muscle may experience a lack of oxygen-rich blood during a heart attack, which can cause aberrant electrical activity and vagus nerve stimulation. As a result of the nerve informing the digestive system of the heart's concern, Symptoms such as nausea, indigestion, or stomach pain may arise. Furthermore, during a heart attack, the deprivation of oxygen-rich blood to the heart muscle can set off reflexes that cause symptoms in other areas of the body, such as the digestive system. In reaction to the heart's distress, the body may release specific hormones or chemicals that can impair digestion and result in symptoms like nausea or stomach pain. Similar to this, during a heart attack, the abdomen may get pain signals from the heart as well as other parts of the body. This may result in discomfort or pain in the stomach that is misinterpreted for digestive problems. Even though these symptoms might not seem connected to heart health, they could be early warning indicators of a heart attack and need to be carefully considered. 5. Pain in the back. Heart attack-related back discomfort can occasionally be brought on by or made worse by things like physical activity, mental stress, or bad posture. Heart pain can be felt in the back due to spinal cord overlap between the nerves that carry pain signals from the heart and the nerves in the back. We call this phenomena referred pain. Heart attack pain can radiate to other parts of the upper body, including the back, in addition to referred pain. This happens because pain impulses can go from the heart to the back due to comparable neural connections between the two organs. The upper back, the space between the shoulder blades, or even the lower back may feel pressured, tight, or achy. It's important to understand that back pain might have other reasons, such as muscle strain, arthritis, or spinal problems, and that it may not necessarily be an indication of a heart attack. On the other hand, back pain should be promptly checked by a medical professional if it is accompanied by other symptoms that point to a heart attack, such as lightheadedness, sweating, chest discomfort, or shortness of breath. 6. Left arm and hand numbness. It is true that numbness in the left arm and hand could indicate a heart attack. Reduced blood flow to the left arm and hand may possibly be the cause of the numbness in these regions. Impaired circulation to the extremities due to ineffective cardiac pumping might cause tingling or numbness in the affected areas. This lack of blood flow may indicate a heart attack or that the heart is not beating as well as it should. The spinal cord in the neck is the starting point for the nerves that descend down the arm to give feeling to the left arm and hand. During a heart attack, the body may release specific chemicals or set off reflexes that might compress or impinge on neck nerves when the heart is under stress. This may result in symptoms in the left arm and hand such as tingling, numbness, or weakness. It's crucial to remember that numbness in the left arm and hand by itself may not always signify a heart attack and can instead be caused by other conditions like pinched nerves, compression of the nerves, or problems with circulation. 7. Lightheadedness. Reduced blood flow to the brain, which can happen after a heart attack, might make you feel faint or dizzy. This symptom could show up gradually or all at once. A coronary artery blockage or narrowing may make it more difficult for the heart to pump blood efficiently during a heart attack. Dizziness or lightheadedness may ensue from decreased blood supply to the brain as a result of this. Feeling faint, dizzy, or vertigo are some of the symptoms that can occur from the brain not getting enough oxygen-rich blood. Because the heart cannot pump blood as efficiently after an attack, blood pressure may drop. Low blood pressure might make you feel lightheaded or dizzy because the brain may not receive enough blood to operate normally. During a heart attack, this abrupt drop in blood pressure can cause symptoms like fainting or dizziness. Because of the tension and anxiety that surround a heart attack, some people may breathe quickly or have hyperventilation. A drop in blood carbon dioxide levels brought on by hyperventilation can result in symptoms including fainting, lightheadedness, and dizziness. These signs could make you feel more lightheaded during a heart attack. It's crucial to pay attention to these emotions because they can point to a cardiac issue. It's critical to get emergency medical assistance right away if you or someone else is exhibiting symptoms that could point to a heart attack by contacting emergency services or visiting the closest hospital. Early detection of heart attack warning symptoms is essential for timely medical attention and better results. We have the power to preserve our heart health and maybe save lives by paying attention to our bodies and acting upon them when something doesn't seem right. Remember to subscribe, like, and comment on Sparkly Health. I appreciate you seeing.